I have patients from other parts of the country, individuals that will give me a call. Yes. Unfortunately, this is a state-by-state law. Not all states approve or offer medical marijuana to their population. Unfortunately, I cannot treat individuals who live outside of New York State. That is New York State's rules, and within the rules and regulation to be able to prescribe, you must be a resident of New York State, and then I could prescribe.
That's if they want to be a patient.
That's if they want a patient.
But if they want education,
that's right.
They can get this book in Timbuktu, Jamaica.
The whole world.
The whole world.
The whole world.
Okay?
This is the whole world.
Okay, and folks, I would get this book, and it's a valuable book there because opium, and we're going to talk about that, is spreading, not spreading, but it's becoming a part of America and a part of the world for the success stories that it is bringing to people and their health conditions. And we're going to talk about opium in a few minutes, but I feel that as the information goes out, you need to be educated because some information going out is not correct. But I can tell you, this book is an education for you, for anyone in these days in which we're living in. We need to be educated. The Word of God says, seek knowledge, and above all, get an understanding, okay? That's what this is all about.
Right.
Medical marijuana, real-life stories. Dr. O'Brien, I'd like to go into, you mentioned, I was amazed at how medical marijuana is being used towards many illnesses.
Yes.
Such as Parkinson's disease.
That's correct.
Such as diabetes.
Yep.
Okay, you want to deal, I read this and it is fantastic. How it's used and the success. Tell us.
That's right. Well, let's be a little bit more specific with diabetes. We're referring to a neuropathic pain, and that'd be diabetic neuropathy, and that is pain that you develop as your diabetes advances. You have uncontrolled blood sugar, and that's the definition of diabetes. We have what's called macro and microvascular pathology. Hardening of the arteries, or atherosclerosis, arteriosclerosis, and then we have lack of blood flow, lack of oxygen going to the nerve endings, and you start to lose sensation. And when you lose sensation, you can start to develop cuts and infections, and we end up losing amputations.
Right.
You go with the toes, and then you go at the ankle, and then to the knee.
Right.
But before we get to that stage, you start to lose sensation. You get the burning sensation, the pins and needles. That's what I'm able to treat with medical cannabis.
Okay. Now, Parkinson's disease.
Yes, Parkinson's disease. That's a medical condition where we're losing a chemical in the brain. It's not being produced anymore, and then you start to lose function. We have control of the muscles. So there's other side effects that you see, but the biggest one is your muscle will get the rigid movement. Not able to walk through a door frame, like they get the shuffle step, and when they enter a door, they kind of like get stuck there. We have what's called pill rolling or lip smacking, and that's due to the lack of chemical that's not being produced. So what we can do is not treat some of the side effects of what that occur from the condition. We're not going to, people want to use the term cure. There is no cure in medicine. We use treatment. Cure means that the condition will never ever come back. So I can treat some of the sequela, some of the other issues that are associated with Parkinson's.
That's what you mean. Now, how is it used then, medical marijuana?
Sure.
How is it used for I read in the book, and folks, you need to really get this book because it is an education. I'm asking them questions so that, because you don't have the book.
Right.
But if you have the book, you wouldn't be asking a lot of the questions. But I'm doing that so that you can get this book.
Right.
You got it? You got to get it.